Hey everyone, welcome back for another deep dive. Today we're getting into something that sounds pretty technical. Evoked potential monitoring during surgery.
It's a fascinating area.
You bet. I was looking over the medical journal excerpts you provided. Are you prepping for surgery or something? Maybe researching a medical topic?
It's research related to my field. Anesthesiology, specifically how anesthetics impact the nervous system during surgery, which is really important for patient safety, by the way, especially in surgeries where there's a chance the nervous system could be affected.
Okay, so let's break this down a bit. We're talking about monitoring those electrical signals in the nervous system, right? Like, how do those signals even work during surgery?
Basically, imagine your nervous system as this intricate electrical grid. These evoked potentials, those are like signals we send along those lines just to make sure everything's working as it should be during the surgery.
Got it. So it's like a way of checking that the nervous system is still online while the patient's under anesthesia.
Exactly. And get this, the kind of anesthesia used can really change how those signals look.
No way. You had info on a bunch of different anesthetics, halothane, isoflurane, desflurane, all sorts. Each one seems to have its own way of messing with those electrical pathways, kind of like they each have their own personalities.
That's a great way to put it. Some anesthetics, like if you use a high dose of certain types, can make those signals harder to read. Makes it tough to spot a problem during surgery.
Gotcha. So for someone going into surgery, what does this all boil down to?
Careful planning is key. Anesthesiologists have to think about the type of surgery, what the patient needs, and even the monitoring setup to make the best choices.
Makes sense. It's all connected. I also noticed your notes mention things like body temperature, blood pressure.
Yeah.
Even the CO2 levels can impact those nerve signals, huh?
It's true. The body's overall state plays a huge role. Anesthesiologists have to keep all these plates spinning during surgery to make sure the nervous system is A-OK.
Wow, that's a lot to balance. It really highlights how important this kind of monitoring is.
It really is all about making sure the surgery is as safe as possible for the patient.
Absolutely. So we've established that evoked potentials are these electrical signals used to check on the nervous system during surgery. But what exactly are we looking at? I mean, how do we even see these signals?
Picture this. You've got these electrodes, like little sensors, placed on the patient, often on their head, arms, legs. They pick up those tiny electrical signals from the nerves.
Okay, so these electrodes are like microphones for the nervous system, picking up those electrical whispers.
Exactly. And these signals, they're incredibly faint. We're talking about microvolts, which is like 1/1,000,000th of the voltage from a AA battery.
Wow, talk about faint whispers. So how do you even pick up those tiny signals amidst all the other electrical activity in the body? I mean, the heart's beating, muscles are twitching. It's got to be like trying to hear someone whisper in a rock concert.
That's where the cool tech comes in. Those signals from the electrodes. They get amplified and filtered through a special computer. It filters out all that background noise so we can actually see the nerve signals clearly.
So it's like having noise-canceling headphones, but for the nervous system. What happens to those amplified signals? How do they actually show up?
They show up as waveforms on a monitor. Think of it like those peaks and valleys you see on a heart rate monitor. But instead of heartbeats, these waves represent the nervous system's activity.
Okay, so we've got these waveforms painting a picture of what's going on in the nervous system. What are we looking for in those waveforms? What's a healthy signal look like versus one that spells trouble?
That's the heart of it, right? We look for consistent patterns and specific things in those waves, like the height of the peaks, for example. That tells us how strong the signal is. A nice, strong peak usually means a healthy nerve pathway.
So a strong signal, good news. What about the valleys in those waveforms? What do those tell us?
Just as important. Those valleys, we call them troughs, they show a dip in electrical activity. We analyze how deep they are, how long they last, all to make sure those signals are traveling at the right speed. A delayed signal or an unusually deep trough could mean something's up with the nerve pathway.
Got it. So it's like a rhythmic dance of peaks and valleys, and if the rhythm's off, it's a red flag. Amazing.
Exactly. And that's where the anesthesiologist's expertise is key. They're watching those waveforms like a hawk, looking for any tiny deviation from the norm. Then they have to figure out if it's because of the surgery, the anesthesia, or something else entirely.
Intense. It's not just watching lines on a screen. It's like deciphering a whole language of the nervous system. So we've got the basics. What evoked potentials are, how we measure them, and how they're used during surgery. But you mentioned different types of evoked potentials, right? Like different ways to listen to different parts of the nervous system.
Exactly. We've got a whole orchestra of evoked potentials, each tuned to a different section of the nervous system.
An orchestra of evoked potentials. I love that. Tell me more.
So one type you'll hear about a lot is somatosensory evoked potentials, or SSPs. They monitor the pathways for our sense of touch. Imagine a surgeon working near the spinal cord. By stimulating a nerve in, say, the leg, SSEPs can track that signal all the way up to the brain.
So it's like a live map of how touch signals are traveling from the body to the brain. That's incredible.
Right. Especially important during spine surgery or anything where those pathways might be at risk. The SSEPs give real-time feedback to make sure everything's still working as it should.
That makes a lot of sense. And this real-time monitoring, it's especially important during procedures where there's a higher risk of nerve damage, right?
Exactly. By watching these signals, surgeons can adjust what they're doing, minimize the chances of any mistakes or complications.
Like having a safety net for the nervous system. Earlier, you mentioned something about lights being on. What did you mean by that?
Right. So during surgery, we use anesthetics to make sure the patient doesn't feel a thing, right? But those medications, they can also affect the nervous system, including the evoked potentials we're talking about.
So it's a balancing act, making sure the patient's comfortable, but also making sure we can still hear those nerve signals.
Exactly. And here's where it gets even more interesting. The type of anesthesia and how much we use can actually change how those evoked potentials look on the monitor. It's like each anesthetic has its own little personality, you know?
Okay, now I'm really intrigued. We've got these signals acting like messengers from the nervous system, and the anesthetics we use can either muffle their message or let them come through loud and clear. So how do different anesthetics come into play here? What happens to these signals under, say, general anesthesia versus a local anesthetic?
That is a fantastic question, and it really dives deep into the world of pharmacology and neurophysiology. Basically, different anesthetics affect the nervous system in their own unique ways. And those effects, we can see them reflected in the evoked potentials.
Okay, let's unpack that a bit. You mentioned general and local anesthetics. How do those two differ when we're talking about evoked potential monitoring?
Sure. Let's start with general anesthesia. When someone's under, their entire brain is basically asleep. So naturally, this affects the evoked potentials we can pick up.
That makes sense. If the brain's asleep, those signals might be harder to catch, right?
Exactly. That's why anesthesiologists have to carefully adjust how much anesthetic they give. You want the patient unconscious, of course, but you also need those evoked potentials to be clear enough to monitor. Too much anesthesia, and those signals can get really weak, making it tricky to keep an eye on things.
Wow, this is a real balancing act. What about local anesthetics? How do they fit into this whole thing?
With local anesthetics, it's a bit more complex. Instead of affecting the whole brain, they just block nerve signals in a specific area. Think of it like this. General anesthesia is like turning off the power to your whole house, but local anesthesia is more like flipping a light switch in just one room.
Okay, I get it. So with local anesthesia, the effects on those evoked potentials would depend on where that light switch is flipped, right?
Exactly. If we're trying to monitor evoked potentials from a nerve that's been numbed by the local anesthetic, well, those signals are going to be super weak, maybe even gone completely, like trying to hear a whisper in a hurricane.
So it's almost like trying to pick out a single faint signal against all the other neural activity that's still going on. Anesthesiologists must need to be incredibly skilled at interpreting these signals.
Oh, absolutely. They go through tons of training to recognize even the smallest changes in those signals, especially when different anesthetics are in the mix. It's amazing, really, that they can monitor these signals, sometimes for hours at a time, and make those crucial decisions based on what they're seeing.
It's really impressive. You mentioned earlier that different types of anesthesia can affect those signals in different ways. Let's get into some specifics. I know you had notes on a whole bunch of different anesthetics. What's a good starting point?
Well, we could start with what are called halogenated ethers, or volatile anesthetics, as they're more commonly known. Things like isoflurane and sevoflurane. They're often used for general anesthesia, and they have some interesting effects on evoked potentials.
Okay, volatile anesthetics it is. Let's talk about isoflurane. How does that one affect those neural pathways?
Isoflurane, like many of the volatile anesthetics, can actually suppress the nervous system. So when we're talking about evoked potentials, this means that as you give more isoflurane, the signals can get weaker. And the time it takes for those signals to travel, the latency, that can increase too.
So it's like Isoflurane is turning down the volume and slowing down the speed of those electrical messages.
That's a great way to put it. And this effect, it's directly related to the dose. So the more isoflurane you give, the bigger the impact on the signals.
Yeah.
So anesthesiologists, they've got to find that balance between giving enough anesthesia for the patient to be comfortable, but not so much that the signals become impossible to make sense of.
So it's all about finding that sweet spot where the patient is comfortable and the surgical team can still get a clear picture of what's happening with the nervous system. How do they find that balance? What tools and techniques are they using to actually monitor these signals during surgery?
Great question. It all comes down to having the right monitoring equipment and a really deep understanding of how different things, like the choice of anesthetic, can affect the signals we're tracking.
Okay, let's talk equipment then.
Right.
What are we working with here when it comes to evoked potential monitoring?
Imagine this. You have these electrodes placed strategically on the patient. Could be on the scalp, the limbs, even near the spinal cord, depending on what kind of surgery it is and which nerves we need to keep an eye on. These electrodes are basically like tiny antennas, picking up those super faint electrical signals coming from the nervous system.
So these electrodes are like listening devices, specifically tuned to the nervous system's frequency. That's incredible.
That's a great way to think about it. And the signals they're picking up, remember, they're incredibly faint. We measure them in microvolts, which is about 1/1,000,000th of the voltage of a regular AA battery.
Wow, that's tiny. So how do you make sense of such tiny signals? I mean, our bodies are just a whirlwind of electrical activity. How do you separate those nerve signals from everything else?
That's where the magic of technology really shines. The signals from the electrodes, they get amplified and filtered by a specialized computer. Think about trying to have a conversation in a really crowded, noisy room. It's nearly impossible to focus on a single voice. But what if you had a device that could amplify the voice you want to hear and block out all the background noise? That's basically what this monitoring equipment does for evoked potentials.
That's incredible. So you've basically created a way to have a clear conversation with the nervous system, even amidst all the electrical activity of the human body. I'm impressed. So we have the electrodes acting as listeners, and then a computer that amplifies and filters those signals. What happens next? How is this information actually presented to the anesthesiologist?
This is where it gets visually interesting. The processed signals, the ones that have been amplified and filtered, they get displayed on a screen as waveforms. Think of it like those ups and downs you see on a heart rate monitor. But instead of heartbeats, these waveforms represent the electrical activity of the nervous system.
Okay, so we have waveforms that are basically painting a picture of what the nervous system is doing. What are the anesthesiologists looking for in these waveforms? How do they know if it's a healthy signal or if something's wrong?
That's the art of interpreting evoked potentials. Anesthesiologists, they're looking for consistent patterns and specific characteristics in those waveforms. For example, they look at the height of the peaks. That tells them how strong the signal is. Generally, a well-defined strong peak means that nerve pathway is healthy.
So a strong signal is a good sign. What about those valleys you mentioned earlier? What do those tell us?
Those valleys, or troughs, are just as important. They show a dip in electrical activity. Anesthesiologists analyze their timing in depth. This helps them make sure the signals are traveling as fast as they should be. If a signal is delayed, or if that trough is deeper than usual, it might mean there's a disruption somewhere along the nerve's pathway.
So it's like a rhythmic dance of peaks and valleys, and if any of those steps are off, it could signal a problem. It sounds like anesthesiologists need to be incredibly skilled to interpret these signals accurately.
Absolutely. They're constantly watching these waveforms, looking for even the smallest deviations, and they have to consider everything. The surgery, the patient's vital signs, the type and amount of anesthetic being used. It's a lot to process.
It sounds like they're piecing together a complex puzzle, and the stakes are incredibly high. They're not just looking at lines on a screen. They're analyzing a whole symphony of data to ensure the patient's nervous system stays healthy during surgery. This is absolutely fascinating. So we've covered the basics, what evoked potentials are, how they're measured, and why they're so important during surgery.
Yeah.
But you mentioned different types of evoked potentials, each giving us a window into a different part of the nervous system. We talked about somatosensory evoked potentials, or SSEPs, earlier. Can you tell us more about those and what other kinds of evoked potentials are used in the operating room?
Of course. SOTs are just one piece of the puzzle when it comes to monitoring the nervous system during surgery. Think of it this way. If you're listening to an orchestra, SSPs would be like focusing on the string section. They give us information about a specific aspect of the nervous system's activity.
Okay, I like that analogy. So SSPs are the violins of the nervous system, telling us about touch and sensation. What other instruments are in this neural orchestra?
Well, we also have brainstem auditory evoked potentials, or BAEPs. As the name suggests, they focus on the auditory pathways, the ones responsible for our hearing.
So BAEPs are like the brass section, letting us know if the sound is coming through clearly.
Exactly. BAEPs are super important during surgeries that involve structures near the brainstem, especially the auditory nerve. They help us make sure those delicate pathways responsible for hearing are protected during the procedure.
It's like having an audiologist right there in the operating room, keeping tabs on the patient's hearing in real time. That's amazing. Yeah. What else? Are there other evoked potentials that help us monitor different parts of the nervous system?
Absolutely. We've also got visual evoked potentials, or VEPs. They're used to assess the integrity of the visual pathways, the ones responsible for our sight.
Okay, so VEPs are the woodwinds, making sure everything is in tune with the eyes.
You got it. VEPs are frequently used during surgeries that involve the optic nerve or any part of that visual pathway. They help surgeons navigate those very sensitive areas and minimize the risk of any vision impairment.
This is incredible. We've got SSPs for touch, BAEPs for hearing, VEPs for vision. It's like having a whole team of specialists, each monitoring a different sense in real time. This evoked potential monitoring is truly remarkable.
It really is. And to make things even more comprehensive, we also have motor evoked potentials, or MEPs. These assess the motor pathways, the ones responsible for our ability to move.
So MEPs are the percussion section, making sure everything is still moving and grooving.
You got it. MEPs are especially useful during surgeries that involve the spinal cord or other parts of those motor pathways. By stimulating the brain and recording the muscle responses, MEPs give us valuable information about how well those critical pathways are functioning.
Wow, it's like conducting a full neurological exam while the patient is still in surgery. That's incredible.
It really shows how far medical technology has advanced, doesn't it? We can monitor the nervous system in ways that would seem impossible just a few decades ago.
This has been so insightful. We've talked about SFPs, BAEPs, VEPs, and even MEPs. It's clear that each type of evoked potential gives us a unique view of the nervous system, letting us monitor different aspects of sensory and motor function during surgery. But it's not all about the equipment, right? It's about the people who are using this technology.
That's a really important point. The technology is impressive, yes, but it's the skill of the healthcare professionals that truly brings it to life. And it all starts with the anesthesiologist.
Okay, let's talk about the anesthesiologist's role. What are their key responsibilities when it comes to using evoked potential monitoring?
Think of the anesthesiologist as the conductor of this intricate orchestra of neural signals.
I like where this is going. So the anesthesiologist is conducting the neural orchestra. Tell me more.
Well, their top priority is making sure the patient is comfortable and completely unaware throughout the entire surgery. That means carefully choosing and giving the right anesthetic medications and keeping a close watch on the patient's vital signs. But it's not just that.
It sounds like an incredibly demanding job, constantly multitasking and making critical decisions. What other responsibilities fall under their role?
They're also crucial for getting that evoked potential monitoring equipment set up and working correctly, making sure those electrodes are positioned just right and that the signals are coming through clear as day. Think of them like the stagehands, making sure all the microphones are in place and picking up every single note. But their biggest job, it's interpreting those signals and communicating any changes or concerns to the surgeon.
So they're not just monitoring, they're interpreting, analyzing, and communicating those findings in real time. That is a lot of responsibility.
You bet it is. They need to be able to spot even the tiniest deviations from the norm in those waveforms and understand what those deviations might mean. They're like the interpreters between the nervous system and the surgical team.
That's fascinating. They're like the multilingual diplomats of the operating room, bridging that communication gap between those delicate nerve signals and the surgical team. So the anesthesiologist has an incredibly important role, but I imagine they're not alone in this. Who else is involved in making sure that evoked potential monitoring is being used effectively?
You're right, it's a team effort. The anesthesiologist works very closely with a neurophysiologist who's an expert in, you guessed it, the electrical activity of the nervous system.
Okay, so now we've got a neurophysiologist on the scene. What's their role in all of this?
The neurophysiologist is key in both planning and actually running the evoked potential monitoring. Before the surgery even starts, they work with the surgeons to decide which evoked potentials to monitor. based on the procedure and the location of the nerves that might be at risk, like a composer choosing the right instruments for a piece of music.
So they're helping to create the monitoring strategy, making sure the right signals are being tracked from the start. What happens once the surgery is underway?
During surgery, the neurophysiologist is super focused, often from a separate monitoring room, carefully watching those waveforms and giving real-time feedback to both the anesthesiologist and the surgeon. They're like the conductor, making sure every instrument in the orchestra is playing its part correctly.
This is fascinating. It's like a beautifully choreographed dance of expertise with the anesthesiologist and the neurophysiologist working together seamlessly to protect the patient's nervous system.
That's a great way to put it. It truly shows what can be achieved with collaboration and how far medical technology has come.
I'm so glad we took this deep dive into the world of evoked potentials. It's really amazing to see how this technology, combined with the skill of healthcare professionals, is changing the way we approach surgery, especially when it comes to protecting something as vital as the nervous system.
I completely agree. It's a real testament to human ingenuity and our dedication to making healthcare better.
Now, we've covered a lot of ground here, from the basics of what evoked potentials are to how this sophisticated technology is used to measure them. And of course, we talked about the essential roles that anesthesiologists and neurophysiologists play in all of this. But there's another layer to this we should talk about, the factors that can affect those signals, sometimes in ways you might not expect.
You're right, there are other factors to consider. While evoked potentials are incredibly useful, we always have to remember that they can be influenced by a whole host of things, some to do with the patient's overall health, and others related to what's happening in the operating room itself.
Okay, now you've got me curious. We've talked about how anesthetics can affect those signals, but what other factors come into play? What do anesthesiologists and neurophysiologists need to be aware of when they're looking at these signals during surgery?
It's a bit like detective work. We have to look at all the clues to get the full picture.
I like that analogy. So let's put on our detective hats and explore some of those factors that can influence these crucial neural signals.
Let's. A good place to start is with the patient's overall physiological state. Think about it. The human body is this incredibly fine-tuned machine. Even small changes in how it's working can affect how those nerve signals are sent and received.
Okay, so we're talking about the body's internal environment, that balance that keeps everything running smoothly. What are some key factors within that internal environment that can affect the evoked potentials?
One of the biggest ones is body temperature. Nerves, those electrical highways in our bodies, are very sensitive to changes in temperature.
All right, we've all experienced numb fingers when it's cold. It's like the cold slows down those nerve signals.
Exactly, and that same principle applies during surgery. If a patient's body temperature gets too low, a condition we call hypothermia, it can have a big impact on those evoked potentials.
So hypothermia is like turning down the thermostat on the nervous system, making those signals weaker and slower.
You got it. Imagine you're trying to send a message on a telegraph line during a blizzard. The cold can disrupt the signal, making it fainter and slower. Hypothermia can have a similar effect, making the peaks on the evoked potential monitor look smaller and whiter. And that can sometimes mask real changes caused by something happening during the surgery.
That's a great way to explain it. So keeping a patient's body temperature stable is really important for getting accurate evoked potential readings.
Absolutely. Anesthesiologists keep a very close eye on the patient's temperature throughout the surgery. They use warming blankets, heated fluids, and other techniques to prevent hypothermia and keep those nerve signals strong and accurate.
Like tucking those nerve pathways in a warm blanket to make sure the signals have a clear path.
I like that. Now, on the flip side, we have hyperthermia, where the body temperature gets too high.
Okay, so if hypothermia is like a blizzard, slowing down those neural signals, is hyperthermia like a heat wave that scrambles them?
That's a really good way to think about it. Hyperthermia isn't as common as hypothermia during surgery, but it can also mess with those evoked potentials, making those waveforms harder to interpret.
So it's all about maintaining that Goldilocks zone, that just right temperature to keep those neural signals happy.
Precisely. Anesthesiologists are always monitoring and adjusting the patient's temperature during surgery, making sure it stays in a safe range. It's not just about the patient's comfort either. It's about making sure those evoked potential readings are accurate.
It's amazing how much attention to detail goes into making sure those signals are clear and reliable. What other factors are anesthesiologists paying attention to?
Blood pressure is another big one. Those nerve cells, the messengers of the nervous system, they need a constant supply of oxygen-rich blood to do their job.
Right. The brain is a hungry organ, always demanding oxygen.
Exactly. If the blood pressure drops too low, a condition called hypotension, those nerve cells might not get the oxygen they need. That can affect how well they send those electrical signals.
So hypotension is like cutting off the power to those neural pathways, making those signals fade out.
You could say that. Hypotension can make those waveforms on the monitor look flatter, making them really hard to see clearly.
Like trying to have a conversation in a windstorm. Those faint signals are getting lost in the noise.
Precisely. Maintaining stable blood pressure is absolutely essential during surgery, especially when we're relying on evoked potential monitoring. Anesthesiologists are constantly checking and adjusting fluids and medications as needed to make sure those neural pathways are getting a good supply of oxygen.
It's about keeping that electrical grid functioning at peak performance.
Yeah.
Making sure those neural pathways have a steady supply of power.
Exactly. And remember, it's not just about preventing low blood pressure. Really high blood pressure can also interfere with those signals.
So it's about walking that tightrope, keeping those blood pressure levels within a healthy range the entire time.
Exactly. It's a constant balancing act, carefully adjusting medications and fluids to keep that blood pressure in that Goldilocks zone. Not too high, not too low, but just right for those nerves to function optimally.
This is all so fascinating. It's amazing how interconnected our bodies are and how something as seemingly simple as temperature or blood pressure can affect those intricate nerve pathways. What other things are on an anesthesiologist's radar when it comes to these signals?
Well, we've talked about temperature and blood pressure, but there's another important player in this physiological orchestra, carbon dioxide, or CO2. It's a gas that's naturally found in our blood.
CO2, that's what we breathe out, right? What role does it play in this?
It might surprise you to learn that the levels of CO2 in our blood can actually change how fast those nerve impulses travel.
Really? That's fascinating. So our breathing, which affects CO2 levels, can actually affect the speed of those nerve signals.
Exactly. It all comes back to that delicate chemical balance in our bodies. When we breathe too quickly, something we call hyperventilation, we get rid of more CO2, causing the levels in the blood to drop.
So rapid breathing, lower CO2. How does that impact those neural pathways?
Lower CO2 levels can actually speed up nerve conduction, making those electrical signals travel a bit faster.
So it's like giving those neural messages a little speed boost. Is that a good thing or a bad thing?
In most cases, those small fluctuations in nerve conduction speed caused by changes in CO2 aren't a major problem. But if the levels get too far out of whack, either too high or too low, it can make those evoked potentials harder to interpret accurately.
So another Goldilocks situation where balance is key.
Exactly. Anesthesiologists keep a close eye on CO2 levels along with all those other vital signs, making sure everything stays within a healthy range. They might adjust the patient's breathing rate if they're on a ventilator, or make other small changes to keep that CO2 balance in check.
It's like fine-tuning a complex engine, making tiny adjustments to keep everything running smoothly.
I like that analogy. And this constant vigilance is really important, especially when we're talking about interpreting those evoked potential waveforms. Even a slight difference in signal speed could be misinterpreted as a problem during surgery if we aren't careful.
So it's all about putting the pieces together, understanding how all these different factors might be affecting the signals.
Yes, it's about seeing the bigger picture, considering all those variables, and using that information to make the best decisions for the patient.
This is all so incredibly interesting.
Yeah.
I never realized that something like body temperature or even breathing rate could have such an impact on those nerve signals.
It really shows how incredibly complex and interconnected the human body is. It also highlights how important it is to have a skilled anesthesiologist and neurophysiologist who understand all these details, who can look at those signals and interpret them accurately, even with all these factors influencing them.
Absolutely.
Yeah.
They really are the guardians of those neural pathways during surgery. They're monitoring, adjusting, and making sure those signals stay accurate. Now, we talked a bit about how anesthetics can affect these signals, but I'd love to dig a little deeper into that. It seems like that's a big piece of the puzzle when it comes to evoked potentials.
You're right. The type of anesthetic and how much we use can really change how those evoked potentials behave. It's really fascinating how the drugs we use interact with the nervous system at that level.
Okay, I'm ready to learn more. Let's dive into the world of anesthetics and their effects on evoked potentials.
Great. Let's start with a group of anesthetics that we often use to induce and maintain general anesthesia, the intravenous agents.
Intravenous agents.
Yeah.
But those are the ones that go directly into the bloodstream, right? Seems like the fastest way to administer anesthesia.
Absolutely. Intravenous agents are fast-acting and give us excellent control over how deeply someone is anesthetized. But when we talk about their effects on evoked potentials, it's not a one-size-fits-all situation. Each one is a little different, kind of like they have their own personalities and they interact with the nervous system in their own unique ways.
Okay, I'm imagining this lineup of different intravenous agents, each with its own quirks and effects on those nerve signals. Where's a good place to start?
Let's start with the classic propofol. It's commonly used for both putting someone under and keeping them asleep during surgery. And its effects on evoked potentials are really well understood.
Propofol, yeah, I've heard of that one. So how does it change those neural messages?
Basically, propofol acts like a volume knob on those evoked potentials. As the amount of propofol in the system goes up, those waveforms we were talking about, the peaks and valleys, they tend to get smaller in height or amplitude.
So it's like propofol is turning down the volume on those neural conversations.
That's a great way to think about it. And this effect, it's usually more noticeable right when anesthesia is being given, when those propofol levels are highest. As the surgery goes on and those levels stabilize, those evoked potential amplitudes tend to bounce back a bit.
Makes sense. So it's a temporary dip in volume, kind of like the body is adjusting to the propofol.
Exactly. And because it's so predictable, propofol is a really popular choice for a lot of surgeries. It provides good anesthesia, but still lets us get those evoked potential readings we need.
It's about finding that middle ground, right? Enough anesthesia so the patient isn't feeling anything, but not so much that we can't interpret those nerve signals.
You got it. It's a balancing act for sure. Anesthesiologists are always monitoring those waveforms, making tiny adjustments to that propofol infusion rate to keep everything in that sweet spot.
Like they're riding the waves of those nerve signals, making sure everything stays in sync.
Exactly. Now, how about we switch gears and talk about another intravenous agent that's commonly used, etomidate.
Etomidate? I've heard of it, but I don't know much about it. How does it compare to propofol?
Etomidate is interesting. Unlike propofol, which often makes those evoked potential waveforms smaller, etomidate can actually make certain parts of those signals stronger.
Really? So it's like etomidate turns up the volume on specific parts of those nerve conversations.
Exactly. This can be really helpful for certain surgeries, especially brain surgeries, where we want those nerve pathways to be as responsive as possible.
Makes sense. If you're operating near the brain, you want those signals to be crystal clear.
Exactly. But it's worth noting that etomidate can be a little less predictable than propofol when it comes to its effects on evoked potentials. The dose, the patient's individual makeup, even the specific type of evoked potential we're looking at, they can all affect how etomidate interacts with those neural pathways.
It sounds pretty complex, like there are a lot of moving parts. Anesthesiologists must really need to know their stuff to use these drugs safely and effectively.
Oh, absolutely. They're interpreting those signals with all these different factors in play. It's a real testament to their skill and knowledge, and they're doing it all to make sure the patient has the best possible outcome.
It's like they're deciphering a secret code, using their knowledge and experience to translate those neural messages into something meaningful. So we've covered propofol, etomidate. What other intravenous agents are commonly used in anesthesia?
Another group we should talk about are the barbiturates, drugs like thiopental and methotrexate. They used to be the go-to for general anesthesia, but we use them a bit less often these days, especially with newer options like propofol.
Barbiturates, yeah, those are some strong medications. What do they do to evoked potentials?
Barbiturates, similar to propofol, tend to suppress the nervous system, and we see this reflected in the evoked potential waveforms.
So are we talking about another case of those neural conversations getting their volume turned down?
Sort of. Barbiturates can decrease the size of those peaks and valleys, making the signals a bit tougher to interpret, especially at higher doses. But they also tend to increase the latency, meaning those signals take a bit longer to travel along those nerve pathways.
So it's like they're dimming the lights and slowing down the traffic at the same time.
That's a great way to put it. And while that might sound like a bad thing, it's important to remember that these effects are generally predictable and depend on the dose. Anesthesiologists know how barbiturates work, and they can adjust the dose to make sure those evoked potential signals are still usable.
It's about knowing the ins and outs of each drug, how it interacts with the nervous system, and then adjusting things accordingly.
Absolutely. That's why communication is key in the operating room. The anesthesiologist, the neurophysiologist, and the surgeon have to work together, share information, and make sure those evoked potentials are giving us accurate and reliable information.
A true team effort. Everyone plays a vital role in ensuring the patient is safe. So we've talked about different intravenous agents, but anesthesia isn't always about putting the entire body to sleep, right? What about regional anesthesia, like epidurals or nerve blocks? How do those techniques affect evoked potentials?
That's a great question. Regional anesthesia techniques, things like epidurals and nerve blocks, they work a little differently. Instead of affecting the whole body, we're delivering those anesthetic medications to a specific area, numbing those nerves so they can't send pain signals.
Okay, so instead of putting the entire nervous system to sleep, you're targeting a very specific area. How does that targeted approach affect those evoked potentials we've been talking about?
It really depends on where exactly that regional anesthetic is placed and which nerves we're monitoring with the evoked potentials.
Could you give me an example?
Sure. Let's say a patient is having knee surgery and they're given a spinal anesthetic. This means we're injecting anesthetic medication near the spinal cord to numb the nerves that carry sensation from the legs and lower body.
Got it. So the nerves in the legs are basically offline in terms of transmitting pain, but what about those evoked potentials?
Well, if we were trying to monitor evoked potentials from the legs in that situation, those signals would be seriously affected, maybe even completely gone, because those nerves are basically blocked.
That makes sense. It's like trying to make a phone call when the line is down. The signal just can't get through. But what if you're monitoring evoked potentials from other areas, like the arms or the brain? Would those be affected too?
That's the great thing about regional anesthesia. Because we're only affecting a specific area, the evoked potentials from other parts of the body, like the arms or the brain, shouldn't be affected much, if at all.
So it's like creating a quiet zone in one part of the nervous system so you can still clearly hear the messages coming from other areas.
That's a great way to put it. It's one of the biggest advantages of regional anesthesia, especially when we're using evoked potential monitoring. By targeting just the nerves we need to block, we can stop the pain signals while still getting important information from other parts of the nervous system.
It's like using noise-canceling headphones on those specific nerves so you can focus on what's happening elsewhere.
I love that analogy. It really highlights how valuable this targeted approach can be. We can make sure the patient is comfortable while still keeping a close eye on those crucial neural pathways.
It speaks to how far we've come with anesthesia. We can now really fine-tune those techniques, providing the best pain relief possible while minimizing the disruption to those important nerve signals.
Absolutely. It's incredible to see how technology and our understanding of the human body are coming together to improve patient care.
I'm so glad we had the chance to dive into this. It's fascinating to see how evoked potentials, combined with the skill of healthcare providers, are changing the landscape of surgery, particularly when it comes to protecting the nervous system.
I completely agree. It's a true testament to human ingenuity and our commitment to making surgery as safe as possible for every patient.
We've covered so much today, from the basics of evoked potential monitoring to how different anesthetic techniques come into play. But like with anything complex, there's always more to uncover.
You're right. And when it comes to evoked potentials, sometimes those deeper layers involve understanding not just how we, as medical providers, might influence those signals, but also thinking about the things specific to each patient that could be affecting those nerve pathways too.
Okay, now I'm really intrigued. We talked about how anesthetics and even things like body temperature can influence evoked potentials. What else comes into play? What other factors do anesthesiologists and neurophysiologists need to keep in mind when they're interpreting those neural messages?
It's really like putting together a puzzle. You need all the pieces to get the complete picture. Sometimes those pieces involve looking beyond the surgery itself and thinking about the patient's medical history, their overall health, even pre-existing conditions that might be influencing those nerve pathways.
All right, let's put our detectives hats back on and explore these patient-specific factors that can influence evoked potentials. This is fascinating.
Great. Let's start with a condition that affects millions of people around the world, diabetes.
Diabetes. That's all about how the body regulates blood sugar, right? How does that tie into evoked potentials in the nervous system?
It might seem like an unusual connection at first, but diabetes, especially when it's not well managed, can actually affect those delicate nerves, leading to something called diabetic neuropathy.
Diabetic neuropathy, right, I've heard of that. It's a complication of diabetes that can cause numbness, tingling, even pain usually in the hands and feet.
Exactly. And those symptoms are caused by damage to those peripheral nerves, the ones that send messages to and from the brain and spinal cord.
Okay, so diabetes can damage these important nerves. How does that affect the evoked potentials we're trying to monitor?
Think of it like this. Those peripheral nerves are like electrical wires. When they're damaged, the signals might not travel as well. They might be weaker, slower, or sometimes the signal can't get through at all.
So it's like having static on the line, making those neural conversations fuzzy.
You got it. When we're looking at evoked potentials, this nerve damage shows up as changes in those waveforms we talked about earlier. The peaks might be smaller, the valleys might be wider, the whole signal might be less clear.
So diabetic neuropathy adds another layer of complexity to reading and interpreting those evoked potentials.
That's a good way to put it. And it highlights why knowing the patient's medical history is so important. Things like diabetes can really change how we interpret those signals.
It's about understanding what those signals mean in the context of that person's health.
Exactly. Anesthesiologists and neurophysiologists, they're taking all of this into account, making sure they're not mistaking a pre-existing condition for a problem that's happening during surgery.
It's like knowing that a certain level of static on the line is to be expected. It lets you focus on any new or unusual changes in the signal.
A great analogy. And that's one of the reasons why that initial assessment before surgery is so important. We need as much information about the patient's health as possible, especially any pre-existing conditions.
It's like gathering all the pieces of the puzzle before you start putting it together. That way, you have a better chance of understanding the complete picture when it comes to those evoked potentials. So we've talked about diabetes. Are there other pre-existing conditions that can affect those neural pathways?
Definitely. Another one that we often see is multiple sclerosis, or MS.
MS, that's a condition that affects the brain and spinal cord, right? The central nervous system.
That's right. In MS, the body's immune system mistakenly attacks the myelin sheath, which is that fatty covering that protects the nerve fibers, those electrical wires of the nervous system.
Okay, so the myelin sheaths are like insulation around those electrical wires. What happens when that insulation gets damaged?
Well, just like frayed insulation on an electrical cord, damage to that myelin sheath can disrupt those nerve impulses. The signals can get slowed down, weakened, or even blocked completely.
It's like those messages are struggling to get through all that damaged insulation.
Exactly. And we can see this disruption in nerve conduction when we look at the evoked potentials. Those waveforms can look different, and that makes them harder to interpret.
It's like listening to a conversation through a wall. The words might be muffled, distorted. Sometimes you can't understand anything at all.
Another great way to think about it, this is exactly why knowing the patient's history of MS, like how severe it is, where the damage is, it's all really important when we're interpreting those evoked potentials.
It's about taking that baseline noise into account so you can be sure you're not mistaking it for a problem that's happening because of the surgery.
Exactly. We always have to consider the possibility that those pre-existing MS lesions are causing the differences we see in those evoked potential waveforms.
It's like knowing which parts of the conversation are already a bit muffled, so you can focus on any new or unusual changes.
Yes. And this really emphasizes the importance of personalized medicine, understanding each patient's unique medical history, and tailoring our monitoring and treatment strategies to them.
It's about recognizing that those evoked potential waveforms, they're not just some random readings on a screen. They're reflections of that individual patient, their physiology, their health journey.
That's a beautiful way to put it. It's one of the things that makes this field so endlessly fascinating. We're combining cutting-edge technology, a deep understanding of how the body works, and the art of interpretation, all to make sure the patient has the best possible outcome.
This has been an incredible journey. I had no idea how complex this whole world of evoked potentials is. It's remarkable how these signals, combined with the expertise of people like you, are making surgery safer. But I'm guessing there's always more to learn and new frontiers to explore.
Absolutely. And one of the most exciting frontiers is how evoked potential monitoring is evolving. We've come such a long way from those basic waveforms, and the future is full of possibilities for making this technology even more powerful and versatile.
Okay, now you've really got me on the edge of my seat. What does the future hold for evoked potential monitoring? What advancements are we talking about?
One of the most exciting developments is the integration of artificial intelligence, or AI, into evoked potential monitoring.
AI, wow. I can see how that would be revolutionary.
Right.
But how is AI being used in this field? It sounds pretty futuristic.
Imagine this. An AI system that doesn't just look at those complex evoked potential waveforms and point out anything unusual, but can actually predict potential problems before they even happen.
That does sound like science fiction, like something out of a movie.
It does, doesn't it? But AI is already changing the face of healthcare, and evoked potential monitoring is no exception. Researchers are developing incredible algorithms that can analyze tons of data, finding subtle patterns and anomalies in those signals that even the most experienced doctor might miss.
So it's like having an extra set of incredibly sharp eyes on those signals, constantly watching for any hint of trouble.
Exactly. And here's the amazing part. AI can process information so much faster than humans. These systems could give anesthesiologists and neurophysiologists real-time alerts, potentially giving them valuable time to react and prevent a problem before it even arises.
Wow. It's like an early warning system for the nervous system. Incredible.
It really is, and this is just the beginning. As AI keeps evolving, I think we'll see more and more amazing applications in evoked potential monitoring. This technology has the potential to make surgery even safer, leading to better outcomes for patients.
This has been such an eye-opening conversation. It's exciting to think about the future of this technology and how it will continue to improve patient care.
I completely agree. It's a really exciting time to be in this field, and I have no doubt that the future of evoked potential monitoring is incredibly bright.
This deep dive has been truly fascinating. Thank you so much for taking the time to share your knowledge with me. I have a whole new appreciation for how complex and important evoked potential monitoring is and the crucial role it plays in making sure surgeries are as safe as possible.
It's been my pleasure. I'm always happy to share my passion for this field. And remember, knowledge is power. And the more we understand about these incredible medical technologies, the better we can advocate for ourselves and our loved ones.
That's so true. And to everyone listening, I encourage you to keep learning about the amazing world of medical technology. It's changing all the time and has the potential to transform healthcare as we know it.
Absolutely. And on that note, we'll wrap up this deep dive. Thank you for joining us on this incredible journey into the world of evoked potential monitoring.
It's amazing how this technology is helping us understand the nervous system in ways we never could before.
Yeah, it really is incredible how far we've come.
Now, before we wrap things up, I have one more question about evoked potentials.
Sure, go ahead.
We've talked about how these signals are used to monitor the nervous system during surgery, but I'm wondering, do they have any uses outside of the operating room?
Absolutely. Evoked potentials are actually really versatile.
Oh, really? Like what?
Well, one area where they've been incredibly valuable is in diagnosing neurological conditions.
Diagnosing neurological conditions. That makes sense.
Right.
So if we think of using evoked potentials during surgery as like listening to the nervous system in real time,
Yeah.
then using them for diagnosis would be more like going back and listening to the recording for any blips or glitches.
That's a great way to put it. It's a way to look for clues about how the nervous system is functioning without having to do anything invasive.
So could you give me some examples of how they're used in diagnosing these conditions?
Of course. One example is multiple sclerosis, or MS, which we talked about earlier.
Right.
Evoked potentials, especially visual evoked potentials, or VEPs, can be really helpful in picking up those early signs of nerve damage from MS, even before someone starts having symptoms like vision problems or trouble with balance.
Wow, so the VEPs are basically acting like an early warning system for the nerves. That's incredible.
Yeah, exactly. Catching those changes early is so important because it means we can start treatment sooner, potentially slowing down the disease and helping people maintain those essential neurological functions.
That's incredible. It's like we can peek inside and see those early stages of the disease, giving us a chance to make a real difference. Are there other conditions where this is helpful?
Absolutely. Evoked potentials can also be used to diagnose things like auditory neuropathy, where there's damage to the hearing pathways, and even certain types of dementia, where we see problems with the parts of the brain responsible for thinking and memory.
Wow, it's amazing how much information we can get from these signals.
Right. It's really remarkable how much we can learn about the brain and the nervous system.
It seems like evoked potentials are becoming more and more essential in neurology.
Definitely. And as we continue to understand the complexities of the nervous system, we'll likely find even more ways to use this technology.
Well, this has been a truly enlightening deep dive into the world of evoked potentials. It's incredible to see how this technology, along with the knowledge and dedication of healthcare professionals, is making a real difference in so many lives.
I wholeheartedly agree. It's inspiring to see how our understanding of the nervous system, paired with these advancements in technology, is shaping the future of healthcare.
To everyone listening, thank you for joining us on this incredible journey. We hope this deep dive has given you a new appreciation for the amazing world of the nervous system and how these remarkable technologies are helping us unlock its secrets.
Thanks for having me. It's been a pleasure.